So let's proceed to the next clinically important virus, and we'll be utilizing the same references that we utilize in our discussions of the other modules of the clinically important viruses. So let's begin with Epstein-Barr virus, okay? This is considered to be the first human virus to be associated with malignancy. And these are the malignancies which Epstein-Barr virus is associated with. Number one is nasopharyngeal carcinoma. Next is Burkitt's lymphoma, Hodgkin's disease, lymphoproliferative diseases, and lastly, leiomyosarcoma. Now, tip, what you have to focus on are these three underlying cancers: nasopharyngeal CA, Burkitt's lymphoma, and Hodgkin's disease. Now, question, where is the most common site? Most common anatomic site or location of nasopharyngeal CA? What is that anatomic landmark? Where do we find most of your nasopharyngeal CA? It's found in the fossa of Rosenmuller. In the fossa of Rosenmuller. So please take note of that. That's the most common site of nasopharyngeal CA. Now, question, what is the translocation that occurs in Burkitt's lymphoma? So Burkitt's lymphoma is usually seen in African American or African descent. And there is a translocation, okay, of what chromosomes? Okay, so for Burkitt's lymphoma, I want everyone to memorize this. This is a translocation, so T, 8, and 14. So translocation of 8 and 14. And if you were to see a biopsy of a lymph node in Burkitt's lymphoma, so the biopsy would show you sheets of lymphocytes, which has what pattern? Okay, it has the sheets of lymphocytes with the starry sky appearance or the starry sky pattern. So please memorize this. Okay, now one more. Trust me, this is what comes out in the boards. Hodgkin's disease or Hodgkin's lymphoma. What is the most common type? What is the most common type of Hodgkin's disease? What subtype is the most common? So the most common is the nodular sclerosing. And the most important cell in the biopsy is the famous Reed-Sternberg cell. Do not take the boards or any quiz if you don't know these. Give you a minute to go over this. So again, emphasis on these three cancers: nasopharyngeal CA, Burkitt's lymphoma, and Hodgkin's disease. And some board exam pearls for each cancer. Now, infectious mononucleosis is caused by Epstein-Barr virus. So this Epstein-Barr virus causes a heterophil positive infectious mononucleosis. With a heterophil positive infectious mononucleosis. And as mentioned earlier, it's associated with neoplasms such as Burkitt's lymphoma and nasopharyngeal CA. Now, as for transmission, this is very important. This is not transplacental. You're not going to get congenital Epstein-Barr virus. This is through intimate contact with the saliva hence the term kissing's disease, because you get this through kissing or close, intimate contact with saliva. Please take note of that. Now, I want you to remember that Epstein-Barr virus utilizes cell receptors. It utilizes the complement receptor 3. Okay, in your textbook, this is CS21 or CR2. So the complement receptor 3. So please take note of this. Complement, it uses complement receptor 3 or the CS21 or the CR2. So complement receptor 3, CS21 or CR2. Now, the best known clinical syndrome which is associated with Epstein-Barr is infectious mononucleosis. And I want to remember, okay, I want you to remember by heart that infectious mononucleosis can either be heterophil positive or it can be heterophil negative. Now, for infectious mononucleosis, the sole source is going to be man. It has a pretty long incubation period, which is as long as 30 to 50 days. Okay, 30 to 50 days. We've mentioned already the mode of transmission, which is basically the saliva. Okay, the saliva. So this is one, kissing. Okay, deep kissing. Okay, sharing of water bottles, and of course, sexual intercourse. Okay, sexual intercourse. So please take note of this. Okay, again, please take note of this. Okay, so please take note of this. For infectious mononucleosis. Okay. Yes, there's a comment here that complement receptor 2. Now you have to take note. It's actually both complement receptor 3 and complement receptor 2, which is associated with infectious mononucleosis. Now, your classic infectious mononucleosis would most likely utilize the 2, okay? But it's both 2 and 3. The thing you have to remember with your complement receptor 2 is the B cell, okay? You have to remember the role of the mature B cells. So aside from the B cells, which is associated with complement receptor 2, you have here the dendritic cells. Now, the dendritic cells are also known as the antigen presenting cells. Okay, the antigen presenting cells. So you see this, that's why you have a lot of lymphomas associated with these diseases, okay, especially in patients with HIV, where the problem is actually these specific immune cells. There's a long family there, CD21, complement 1, complement 2, complement 3, okay? We do have a separate immuno lecture, but yes, that's actually correct, that EBV, the virus itself, okay? The virus itself would utilize complement receptor 2. Please take note of that. CD, so that's going to be complement differentiation. CD. Okay. So CD21, so that means cluster of differentiation 21. Okay. Here, just in case you're confused, let me type this. Complement receptor 2. We haven't discussed this yet. Okay, so this is CR2. Okay, this is also known as C3 D receptor. Okay, which is also known as the Epstein-Barr virus receptor. Okay, take note of this. And CD21 or cluster of differentiation 21. Okay, we won't dig too deep into this, just take note of this. Okay. Again, just remember B cells. For now, just remember B cells. Okay. Now, here, presentation. You have your presentation of infectious mononucleosis. There's lymphadenopathy. There's usually splenomegaly. Okay. There's usually hepatosplenomegaly, actually, with involvement of the spleen more common. There's usually exudative tonsillitis. Okay, there's usually exudative tonsillitis, which is the classic picture. There's going to be pharyngitis. So a couple of differential diagnoses, especially if you have a child. Would be one, you have to make sure it's not diphtheria. Diphtheria present with the grayish pseudomembrane. Okay, so please take note of that. It also presents with the bull neck or the marked lymphadenopathy. So that's one of your close differentials there. That is for infectious mononucleosis. Now here, you have here the pharyngitis. So difference from the previous picture, and the previous picture had exudates. Now, how do you diagnose? So this is what I want everyone to memorize. Okay, don't enter the testing site if you don't know this, the atypical lymphocytosis. Okay, please take note of the atypical lymphocytosis. Then we have the diagnosis, which is going to be confirmed by serology. So we test for the heterophil antibody. This is the Paul-Bunnell test. Okay, the Paul-Bunnell antibody test. Now, your challenge with the diagnosis of infectious mononucleosis, if you rely on cultures, is that it takes quite a long time for the cultures to grow, about 4 to 6 weeks. So in your Paul-Bunnell test, you're going to test for agglutination of your sheep's RBC. Yes, agglutination of the sheep's RBC. So here, this is what's found in your textbook in Robbins. This is the atypical lymphocytes. Question, what is the specific name for these lymphocytes? What is the specific name for these lymphocytes? They're called bodies. What do we call them? In infectious mononucleosis, what do we call these bodies? Okay. What specific name do we call these bodies? Okay, the atypical lymphocytes that you usually encounter, in infectious mononucleosis. So we call them the downy type 2 cells. Okay, the atypical lymphocytes, we call them the downy type 2 cells. So here, IM for infectious mononucleosis is IM, Iron Man. And who plays the role of Iron Man? Okay, who plays the role of Iron Man? It is Robert Downey. Okay, Robert Downey plays the role of Iron Man. IM is IM infectious mononucleosis. Always remember that for your exam. So here, don't forget the kissing's disease, intimate deep kissing. And here goes the Chevrolet again, okay? So which malignancies are associated with Epstein-Barr? I believe we mentioned them earlier, with special emphasis on Burkitt's lymphoma and nasopharyngeal CA. So that ends your mini module on Epstein-Barr virus.